You've probably taken it dozens of times, for fever, headaches, or when your body just feels off. A small, white pill that quietly relieves your pain, without you ever questioning how it actually works. This is paracetamol, the world's most common drug. But behind its simple look, lies one of the most fascinating stories in modern medicine. The story begins in the late 1800s, in Germany. Scientists were searching for new ways to reduce fever, and stumbled upon a compound called acetanilide. It worked, but it was toxic. Then came phenacetin, a safer alternative, until doctors realized it could harm the kidneys. Finally, in 1893, a chemist named Harman Northrop Moore synthesized a compound called paracetamol. But no one noticed. It sat forgotten for more than 50 years, until researchers rediscovered it in the 1940s and realized it was the safest, most effective pain reliever yet. So how does this little pill stop pain? When your body gets injured or inflamed, it releases chemicals called prostaglandins. They tell your brain, hey, something hurts. Paracetamol blocks the enzyme that makes prostaglandins. The signal is cut off, and the pain disappears. But here's where it gets tricky. Scientists still don't fully understand how paracetamol works in the brain. Some believe it also affects serotonin, the chemical that controls mood. Others think it acts on the endocannabinoid system, similar to how cannabis affects the brain. In short, it's one of medicine's biggest mysteries, a drug that works perfectly, but whose full mechanism we still don't understand. After you swallow it, paracetamol travels to your liver. Most of it is safely broken down into harmless substances that leave through your urine. But a small portion, around 5 to 10%, turns into a toxic compound called NAPK. Normally, your liver neutralizes NAPK using a molecule called glutathione. But if you take too much paracetamol, your glutathione runs out, and the toxic NAPK starts destroying your liver cells. Paracetamol is safe, but only within limits. Taking just double the recommended dose for several days can silently damage your liver. In fact, paracetamol overdose is one of the leading causes of acute liver failure worldwide. Symptoms often don't appear immediately. You might feel fine for a day or two, and then suddenly, your liver begins to fail. That's why every box warns you, do not exceed 4,000 milligrams per day. Because beyond that line, the medicine becomes a poison. Many people think paracetamol reduces inflammation, but it doesn't. It only reduces pain and fever. Others think it works faster when crushed or taken on an empty stomach. Not true. It's absorbed just fine within 30 to 60 minutes. And no, it doesn't cure fever. It simply resets your brain's thermostat, so your body feels cooler. That's why, when you're sick, fever often returns once the effect wears off. Paracetamol is best used for mild to moderate pain, fever, headache or toothache. But, avoid it if you have liver problems, drink alcohol frequently, or are already taking other medicines that contain paracetamol. Always check the label. Because many cold or flu medicines already have it hidden inside. It's easy to underestimate something so common. But paracetamol has saved millions of lives, quietly, humbly, and effectively. A reminder that even the simplest medicine deserves respect. Because sometimes, the most ordinary pill holds an extraordinary story.